So I'm very pleased to welcome Sheila Kant, World Bank Group CFO, Michael Creamer, Professor of Economics at the University of Chicago, Director of the Development and Innovation Lab,
Hi.
Sanya Nishtar, the CEO of Gavi, that we heard quite a bit about, all joining us around this cozy table. So thank you very much. Thank you very much to all of you for joining us. And I think it'll become clear through this conversation that a lot of you are familiar with each other, have worked with each other in different fields. So I really appreciate your time and thank you very much for joining us. Just to complete the conversation you've very helpfully started us on, Bill, you talked there about what development aid has produced. What do you see the role of philanthropy in the program of works that you set out there? What is the role that philanthropy should play?
Well, there's always this discussion of, what should taxation systems be in countries? So, that's kind of a separate thing. Should they be more progressive and should these gigantic fortunes be somewhat smaller? Which I believe the US tax system, which is the only one I know well, should be somewhat more progressive. But even so, at least under the system I believe in, there will still be large fortunes, not as large, maybe half or less. But, I do hope that the people who are lucky enough to be winners in this system, that they not only feel some sense of responsibility, but that in, either with their children or late in their career, that they get as much sense of fulfillment by taking those resources and the types of skills they develop that allowed them to be successful and apply that to helping in these equity issues. So I have a thing called the Giving Pledge,
yes.
Where I encourage those who are very wealthy to get together and to learn about what philanthropy works well. A lot of people don't think about giving outside their own country, and it's great. Our foundation gives about 10% of what we do is in the United States, and I won't claim that the impact per dollar of that money matches what we do globally, but for reasons of that's the system that helped create it, we do that. But yes, at the individual level, philanthropy is amazing. A lot of people are very, very generous, and we should push philanthropy. But for the very basic needs, you really don't want to have to depend on individuals. You want the rich countries to come together and solve these basic issues.
Okay, and Sheila, maybe I could bring you in here, because wherever the money comes from, the money that was required during COVID-19 to shore up health systems, to get the money out of the door in a hurry, to meet very real needs in a short time, it taught us a lot, I suppose. And I guess you've learned a lot through the COVID experience about the importance of investing in resilient health systems.
It's difficult for me to think about health and dissociate it from development and growth. So good health, and Bill, you mentioned, without good health, children cannot get educated, the young people cannot get productive jobs. So the two are inextricably linked. And this is what COVID taught us. COVID, had a huge setback, of course, for people's health, for children's education, for jobs, for informal sector, all of it. And we dealt with it. We were very quick off the mark. But, just coming back to where we are today, I think what's really important, and this is important for all of us, including the finance ministries, the health ministries, all the government ministries and arms in these countries, to think of health as an investment and not as an expenditure. Because like children going to school, getting good jobs, there is no way without good health, you can't have good human capital, you cannot have growing and thriving economies. So that's really important. And of course, the problem is so huge. I mean, these are very obvious primary points, but it is worth reiterating. We work very closely with Bill and Melinda Gates Foundation. We are working with Gavi. We are working with WHO and the Global Fund, many of the partners. Each of us brings something to the table when we work together. And we need to work towards our comparative advantage so that we then collectively become a much bigger whole. Just to give you a very quick example, you talked about innovation. This is innovation in finance. There is this entity called International IFIM, International Immunization Financial whatever. Okay, sorry about that, but it's called IFIM for short. We have lots of abbreviations in the World Bank. We have a partnership with them. We issue bonds for them in the capital markets, and that funding is then passed on to Gavi, which helps immunize children in developing countries. So this is the power of financial innovation. There are many other technical innovations that we do. But let me stop here.
Okay.
Yes.
Yes.
I know you're...
Well, that takes us on to my next question
Yes.
to Michael, because you're talking there about innovation.
Yeah.
Michael, a lot of your work is in the field of social innovation. How do you apply, when we're talking about where health, wealth and climate meet, and climate becomes more relevant as we continue talking, how do you apply that lens of innovation to tackling poverty and the climate crisis and the polycrises that we're talking about today?
Sure. Well, economists think of innovation quite broadly to include both technological innovations like the vaccines that we just heard about, which have had amazing impact, climate-resistant seeds, but also new business models and policy approaches, such as climate-responsive social protection programs. They could get resources to families before the flood happens rather than afterwards, so they can get out and get some of their equipment out. And we know returns to scientific investment are very high. So, for example, thinking about climate, if you thought just about the Green Revolution, that's something that was supported in part by international development assistance. If you took out all the effect of all the other development assistance, that would have paid for everything by itself, the impact that that's had. And of course, I don't want to claim that that was uniform in terms of its impact. Or if you think about CGIAR, which funds a lot of agricultural research, the estimate that returns $10 of benefit for every dollar spent. So investing in innovation is in a time of budget tightness, it's very important. I think what we found is you asked about social innovation, and there was less evidence on this until recently. But we recently took a look at the portfolio of Development Innovation Ventures, which is USAID's open innovation fund. And so I'm involved with that, so not totally neutral. But another example of one of these is France's FID. So they're both set up to be open ideas to ideas in many different sectors and to a wide range of applicants. But then you discipline that with a tiered funding system. So very small grants to pilot ideas, somewhat larger grants to rigorously test for impact and cost effectiveness. And then the larger funding is reserved for things that have proven to be most effective and have the most impact. So an example, just to make this more concrete, I believe that the Gates Foundation funded this as well. We supported development of software for community health workers. And then the rigorous evaluation of this was sort of a smartphone app. And the evaluation found that led to increased rates of antenatal care for mothers and of childhood vaccination. So you can imagine that pays for itself very quickly. And that then scaled to 60 million people. And more recently, the government of India developed their own software system, reaching hundreds of millions more, not community health workers, but patients of the community health workers. So when we aggregate across our whole portfolio, we took the cost of the whole portfolio, set that against the benefits of the innovations which scaled, which are obviously a subset, and we got the benefits are very conservatively 17 times the cost of the full portfolio.
Okay, so this is the return on investment in this kind of social innovation that we're talking about here, and innovation has come up at least 3 times just around this table already. And coming on to you, Sanya, when we think about Gavi, the model is quite innovative there, I suppose, this public and private partnership in global health. What can we learn about the model and the effectiveness of bringing these groups together? Bill talked actually about the importance of collaborating.
So I think we've learned a lot from Gavi, and I think we should be thankful to Bill for playing such a salient role in its creation and continuing to support it. I think one of the things that we've learned is that new governance models can work, because in the multilateral system where we were very fixated on the membership member state-driven model. So we've learned that a governance model with multi-stakeholder participation, with private sector mainstreamed into decision-making can actually work. We've also learned from the Gavi's execution that a lean operating model, and by leveraging partners on the ground, can enable you to execute better and with lesser costs, far more effectively. So Gavi's model is grounded in leveraging the Alliance, which is our name for WHO and UNICEF on ground. That has worked. And I think one of the most important learnings is that you can combine sustainability on the one side with health impact and economic gain on the other. And I think that's a very important learning, because on the one hand, Gavi's model shows that it has created very wide-ranging impact, as Bill just referred to. We've vaccinated 1 billion children, we've halved child mortality, 17 million lives saved, alongside massive economic gains. So for every dollar spent, the economic gain is to the tune of $56, and cumulatively there's a massive amount of economic gain that has accrued. So on the one hand, there is impact at a human level, there are economic gains, plus you combine that with sustainability. So the model is such that everybody pays. The countries contribute, the development partners contribute, and there is a path to sustainability and to countries taking on that agenda over the course of time and exiting assistance. And we've seen that happen with 19 countries. So the combination of impact, economic gain, and sustainability in a model is quite unique, and that is what Gavi has demonstrated to the world. Also, in terms of lessons, you referred to IFIM, and I think Gavi has demonstrated that for public sector outcomes, you can leverage development finance, and you can use it very effectively. And finally, I think one of the key learnings has been that when you create the right structures, when you make them agile, when you mainstream innovation to the core, you actually make institutions very resilient. So we saw how Gavi was able to step up during COVAX and create those vaccine platforms. And I think part of my job is to make sure that those learnings, those core capabilities, those different strands of work that came into play, and that we join the dots between them to make sure that should we be confronted with another situation, we will be much better prepared.
So we've learnt a lot then from this public-private model, from what you've described during the COVID pandemic. You mentioned, Bill, during your keynote speech, you mentioned AI, and I wonder if AI helps us at all to get to some of the places that people in this room want to get to more quickly. Are there examples where this is something we can employ to speed up the work that's happening?
Well, absolutely. The big breakthrough where AIs are able to read and write in a powerful way is less than 2 years. And so, it was about 6 months ago the foundation solicited, primarily in Africa, ideas about how they'd like to use AI systems. And, we had a lot of ones that were health-related, so pregnant women able to talk in their local language and get advice about the visits they should be doing, or if they have certain symptoms, how they should seek care. We had a lot to help farmers. It's estimated that Africa is missing 4 million health workers, and we're not going to have enough finance to come up with that. And so the idea that we should take these AI capabilities and create that, it's very, very exciting. The AI also plays a big role on the upstream, understanding things like biological systems and the gut microbiome. Yesterday I was in Copenhagen talking with Novo Nordisk, who's had a lot of success on overnutrition, and how they've now made commitments, because they're partly owned by a foundation, to help fund the research that we do in undernutrition, malnutrition. And improving nutrition is super important, because kids actually would survive even some diarrheal episodes or malarial episodes if they're on their growth path. And so that's a huge priority for the development community, and AI, because it's such a complex system, will play a big role there. So, we have to make sure that these technologies aren't just used for rich world applications.
Okay, and sticking with the innovative theme, Michael, I know that you've worked in the area of water treatment in particular, and have examples that you can share around how policy action in that space has led to real-world impact.
Sure. So waterborne disease is a major cause of child mortality. And together with colleagues in epidemiology and biostatistics, we recently released a meta-analysis. And that meta-analysis combines multiple randomized controlled trials. So in this case, 18 of them. And there were almost 30,000 participants across these. And we found, maybe we weren't surprised that we found that water treatment reduced child mortality. But the magnitude was really much larger than we expected. We found that water treatment averted 1 out of every 4 child deaths of all-cause mortality. Now, water treatment's very inexpensive, at least basic water treatment to address fecal contamination. So the combination of huge impact and low cost makes it really one of the most cost-effective approaches available, comparable to improve health, comparable to childhood vaccination. So we shared the results with the government of India. The Jal Jeevan Mission, which is a big government of India program, is trying to bring piped water to all rural households. And they've actually had very substantial progress toward that goal. And they then decided that they were going to try an approach, a technology called inline chlorination, which can work to treat water, even in very small systems, even where there's no electricity. And it's very inexpensive. And they're trying to scale that up nationally. And the estimates that we found suggest that could save up to 135,000 child lives per year. So that's an example of very big policy action by a middle-income country. Now, obviously, there are a lot of places where there's piped water is a long way away, realistically. And another approach is to distribute small bottles of dilute chlorine solution, which households can use to treat water themselves. That's socially marketed in a lot of Africa. But there's a small cost, and even a small cost is enough to stop most households from using it. So an approach would be to complement the social marketing with distribution through maternal and child health networks, because those networks already exist. Most, thanks a lot to the work of people here, most mothers are delivering in clinics, or at least getting antenatal care, let me put it that way, and they're getting vaccination. So it's then possible to use that as a touch point to distribute for free to the mothers of kids who are most likely to die, the water treatment solution. And I think that can complement the commercial distribution. So I think that's another very promising approach with some early evidence from studies of impact, and some governments now trying to do this, integrate this into their systems at pilot level.
New real-world examples. Sanya, at Gavi, I know that universal healthcare is a real focus. Another area that perhaps needs innovation. And talking to your team, they were talking about innovation in the last mile and where innovation is needed in that context. What more can you tell us about what needs to happen there?
So innovation at the last mile is absolutely crucial, and I'm very glad that you brought it up, because the organization has a history of investing in innovative financing instruments, and we talked about it during the last round, and those are extremely impactful. The advanced market commitments, the market shaping leverage, the IFM that we talked about. There are a number of other different innovative instruments on the horizon. So that part the organization is very good at. But there's substantial space to draw on AI, for example, or to draw on blockchain, for example, to make those quantum leaps at the last mile. And I'll give you a couple of examples. For instance, we are an execution engine. We are an implementing agency, and the grant-making cycle and efficiencies within that space and responsiveness is crucial for us. And I think AI can fold months of work into seconds, literally. Talk about reporting. We have a number of different entities report to us. They're partners on the ground who execute and report back to us. And there are Excel sheets and ledgers and PDFs and papers. And you throw everything into an AI engine and you get a very neat summary of what you ought to look at. We've got country focal persons, and people are really overwhelmed with work. And I think some of these some of what the LLM modules can offer, which are very basic, even open source, can be transformative for the way we execute at the last mile. I think it's a question of institutionalizing them, having a different mindset. I mean, we as an entity have to be constantly prepared for a next outbreak, for a next pandemic, and be prepared at a very practical level on how we're going to align our SOPs, how we're going to triangulate data. I mean, for me, the reference point is that if there's another pandemic, we should be able to just switch on the light of a control room and take our seats and operate. And I think the potential that AI provides you and how it enables you to triangulate data from many different sources, because I see it from the other side of the table as well. I was the Minister of Social Protection when COVID had struck. And as a country, Pakistan had, as any other country in the world, had to mount a response. So the plethora of data streams, the challenge of triangulation and having meaningful information can really be bridged through AI, as can AI, because you referred to last mile, help us with the identification of those trouble pockets that we continue to struggle with. I know we struggle with polio around that. We struggle with routine immunization. There are, in our parlance, we call them the zero-dose areas. You know, these communities that we are absolutely unable to reach. And there are a number of different variables factoring into that inaccessibility. That is where these last mile innovations can be so transformative.
Okay. I'm sure there's a lot you agree about there, Bill, talking about the potential of AI. I mean, you were saying there months of work turned into seconds of work by using large language models, for example. I mean, you have to assume that the large language model is producing something sensible and not making things up, though, I suppose, in that situation, Bill. I mean, you hold out a lot of hope for this kind of implementation.
Well, at the current state of the art, it's a fantastic aid where the final review is done by the human. The work going on to improve the breadth and accuracy of these things is pretty phenomenal. I mean, I don't think there's ever a problem in human history that had as much IQ and as much money going against it on a global basis. And so we see pretty good improvement. But people should not be confused. You can use these things today, and if you do that final review, it will bring insights for you, and it will save time for you in a way that is pretty profound. And if you learn how to do it now, as these systems improve, you'll get even more benefit over time.
In planning this conversation, I should have done just that, but I confess I didn't. I missed a trick. I missed a trick there. Anshula, if we move on slightly in our conversation, linking the dots between health and climate challenges, and I know that's something that the World Bank reform agenda at the World Bank is focused on. And what was clear in planning this conversation today, talking with your teams, was the links between health and climate, how health activities can be thrown off track by flooding, for example. And so the linkages are there and clear to see. Talk to us a little about the way that the World Bank is now moving, well, more towards dealing with some of these climate challenges.
As I said earlier, we look at it as a whole of economy approach in many ways. You think about sanitation, food security, malnutrition. These are all things that play very much into the health of children and health of adults as well. But you earlier mentioned about the universal health care. I just want to share, it's important to have large ambitions, and we've seen Bill proving it time and again in the past. So we've now agreed from the World Bank Group to target at least 1.5 billion people we will reach with better health care services, primary health care services. We won't be able to do it alone. Of course, we'll have to work together with partners around this table and elsewhere. But the idea is now, to provide a basic level of care through every stage of a human being's life, starting from maternal, infancy, childhood, adolescent, adulthood, and now aging societies, so non-communicable diseases, etc. The second point I want to make is particularly about, Bill, you talked about Gavi, you talked about the government budget, and I've been meeting the government authorities yesterday. IDA, International Development Association, it's the solidarity fund for the lowest income countries, for the poorest in the world, and you've been a great partner for IDA, thank you. That is going through a replenishment this year. If you think about small things, community workers, healthcare workers going into local communities. Were it not for numerous IDA programs, you wouldn't be able to provide these basic health services in many of these countries. IDA will look at clean water, it will look at clean air, and we talked about AI and smart solutions, but I do want to mention, even with the current level of technology, for instance, we found in Madagascar, malnutrition was one of the key reasons for poor health in children. And through the smart use of climate data, we can make targeted investments to improve food security and improve nutrition for these children. So many of these challenges are interconnected. We have to work together towards them. And with good partners, I hope we'll get to that 1.5 billion over the next few years.
And talking about the use of technology to forecast better takes me back to you, Michael, and some of the work that you've been doing and the way that weather forecasting can be vastly improved using AI and other technologies.
Right. Climate change, obviously, it's changing weather patterns. That makes the job of farmers much more difficult. We were talking in the green room. Farmers have to make a bunch of decisions: what crops to plant, whether to try and use a climate-resistant seed, when to plant, when to harvest. That's all harder with climate change. The good news is weather forecasting is getting much better. Both traditional physics-based approaches and AI. AI is developing very rapidly. AI forecasts are now probably better at short-term forecasts. They're not quite there for seasonal forecasts. But for example, just to give an example, it's now possible to get forecasts, quite reliable forecasts in many parts of South Asia a month in advance of when the monsoon is coming. Well, farmers know when the monsoon is coming a month in advance. They have time to adjust a lot of aspects of their agriculture. And there are multiple studies now, studies from India, from Pakistan, from Latin America, showing that farmers, in fact, do react to this information, and it can be delivered digitally. Now, it's actually even the physics-based forecasts are relatively cheap, $4 or $5 million per year to produce this for a dozen countries. The AI forecasts could be much, much cheaper than that. Many of them are open source. So there's just tremendous opportunity to provide these to farmers. And an example of this, the government of India, the Ministry of Agriculture there, has a list of 100 million farmers' phone numbers. They're going to, this year, and actually in the next few days, they'll be supplying monsoon onset forecasts to 7 to 10 million farmers. And that could potentially scale up to maybe closer to 100 million over time. Other countries could do this. I don't want to oversimplify this problem. We were talking before. You need better weather stations to collect the data. You have to train the AI models. You need to train them on some data. Big parts of the developing world, you need more weather stations. But even with the data we have available now, we could be providing much better information very inexpensively with benefit-cost ratios easily 100 to 1.
Does your urge to innovate, Bill, take you into this field, into the climate field? I think you mentioned agriculture and the benefits that can be brought there.
Yeah, when we talk about climate, it's important to separate climate mitigation, the reduction of emissions, from climate adaptation, which is helping people deal with these ill effects. For the low-income countries are well under 2% of emissions. They're about 15% of the world's population. So that's Pakistan, Nigeria, most of sub-Saharan Africa, other than South Africa, is still in that category. And there, these health interventions, the mosquitoes are showing up in new places, so we need more bed nets. The crops, they have to change, so they need better seeds that deal with drought and flooding better. They need better farmer advice, including this weather thing. And so, yes, agriculture has become a very big part of what we do, because if you want to improve nutrition, and so this seed innovation, which grew out of the Green Revolution, although that didn't focus on Africa as much as it should have, now that's the CG system, which strangely we are the largest funder of. I don't know why we're the largest funder of it, because the impact for extra work, particularly in the face of climate, the hugest adaptation thing is giving people better seeds, and so that they don't have these crop problems that are caused otherwise. So the mitigation agenda is mostly middle-income, rich countries, and we need to go as fast as we can so we minimize these impacts. We know that we're not going to have zero impact, so that's why the adaptation agenda and helping these countries get healthy so that their overall population levels are not past what they can deal with or what the environment can handle.
And I know, Sanya, you've seen on the ground in Pakistan the need for that adaptation. And I think the floods in 2022, the amount of damage to health facilities specifically. So a very obvious example, I suppose, of the way that climate and health challenges are linked.
Absolutely. I saw the devastation firsthand. But how do institutions like Gavi help within that space? And I think it's important to appreciate that each institution can play a significant role. At Gavi, for instance, we help with building health systems resilience against all kinds of disasters, and particularly climate-related disasters. And within that space, we maintain stockpiles of vaccines, for instance, which come into play. There are warehouses, and there is a whole ecosystem, supply chain ecosystem, and the digitization that enables it, and the whole from the factories to the shipments to the warehouses down to the and that's the invisible backbone. Nobody can see it, but it exists. And institutions like Gavi create it over decades, and the stockpiles really come into play during disasters. Also, Gavi has an instrument called the cash support for countries. This is, at times, a fairly flexible tool which can come into play during disasters like this. And I've seen from my experience in Pakistan, where there are outbreaks and emergencies, these monies are repurposed and mobilized very quickly, and they help conduct campaigns, and they help with capacity building, they help with surge financing. And also Gavi has a policy and an instrument which gets mobilized in fragile contexts.
Yes.
So you can deploy it on a case-to-case basis, depending on whether it's a conflict setting or a disaster setting. And then we have a way of working with the humanitarian entities very well. There are vaccines within the Gavi portfolio that deal with diseases that have a direct link with climate change and with climate emergencies. There are waterborne diseases like cholera, like typhoid, like rotavirus that Bill talked about. There are other vector-borne diseases, such as the malaria vaccine. It is actually in execution. The yellow fever vaccine has been there for a long time. The dengue vaccine is in the pipeline, and that's part of the ecosystem of resilience that they built at the health systems level And from my country vantage point, I can see how valuable they are.
Yeah.
From with my current hat on, I see what an important contribution the organization is making
Yes.
across many countries.
So further examples there of collaboration. That theme has come up a lot during the conversation. Innovation coming up a lot during the conversation as well. One of the things we haven't touched on around this table, but you mentioned, Bill, is the way that aid budgets are maybe being challenged or harder to defend in the views of some politicians when times are tough, when inflation domestically is surging. Given the number of political events we're going to see this year, are you hopeful? You're often quite hopeful. Are you hopeful that aid budgets can pick up again, or does that feel far off and distant?
Well, if you look at aid budgets, they have gone up somewhat, but a lot of that money is now going to acute crises. So the human development money for Africa has already gone down, and that's before a number of cuts that are coming through the system. Some of them related to the priorities in Ukraine. You have lots of in-country refugee costs, which count against that development budget. You had a lot of pandemic-specific things, but the general funding for Africa, sadly, has gone down at a time when their financing situation is very difficult because the interest costs that have gone up in the entire world have gone up even more in Africa, and they're more indebted today than they've ever been. And so, they're paying more in interest costs than they are able to fund their health and education system. And, it's great. The World Bank has been speaking out about this and, saying, how do we come together? How do we get more value out of these fantastic instruments like IDA? But we're going to have a bit of a lean time for Africa, which means prioritizing the very high impact interventions and making sure we're not cutting across the board, that we're being smart about, even for a few years, if the overall aid budget to low-income countries is not as high, the really fantastic things are maintained.
Okay, Bill, thank you very much. That brings our conversation to a close. I'd like to thank you all for joining me, for joining us today. Thank you very much.
Thank you.